Good, y'all. Welcome back to the channel. Subscribe for more videos. Don't forget to like and share, and also leave a comment down below and let us know your opinion on the material discussed. In this next video, a distraught family speaks on a horrifying discovery during their mom's COVID hospitalization. Check this out.
This family says lack of medical care by staff at South Coast Global Medical Center in Santa Ana led to their mother's death.
I ran around so much for my mother and to try to save her.
Carolina Mijango says she and her siblings did all they could to help the nurses here treating their mother as she battled COVID-19 in the summer of 2020, taking turns bringing meals, making friends with the staff.
It felt like a betrayal to that trust because they kept telling me she's okay, she's gonna be okay. We're giving her the utmost care.
Finally, at the end of July, Concepcion Covarrubias tested negative for COVID-19. Her children asked to move the 65-year-old to a rehab center, but say their request was denied. In the weeks that followed, Mijango says her mother's infection levels rose. Her children say the conditions of their mother's makeshift room were unacceptable.
That to me was not acceptable. Not in America. Not these kind of hospitals.
Then during this visit from Concepcion's son and daughter, Manuel Mijango knew his mother was in pain.
She was crying and she was going through a lot of pain, and I told my sister, my mom is not okay at all.
A devastating discovery caught in this video call. Concepcion's son's reaction seen here when he found maggots in his mother's nose and mouth.
Maggots pumping out of the nose.
Concepcion's children are suing, alleging elder abuse, negligence, and wrongful death. A spokesperson says the hospital is not commenting while litigation is pending. According to the complaint filed in court, nurse notes state 2 or possibly 3 dozen maggots started coming out of the patient's right nares. Concepcion passed away a few days later on August 21st. Her children say their mother was well loved by everyone, always caring, supporting others, not deserving of this.
I wouldn't want anybody else to go through the same thing, to be such strong advocates, and at the end to feel so betrayed.
First and foremost, condolences to the family for the loss of their mother. I can't imagine how hard it must be to lose a parent, and the condition in which they observed their mother in her last days. I bet it doesn't make it any easier to cope. Could you imagine? You entrust the care of your sick loved one to the professionals, only to find flesh-eating larvae crawling out their body, and they're still alive? Oh no. God bless them, because I would have turned that whole place upside down. We've all heard chatter claiming most of the individuals who passed from COVID, may they rest in peace, may have actually passed away due to neglect. I've heard stories of nurses' aides who avoid going into the rooms of COVID patients because they didn't want to be in the quote-unquote COVID room too long. I've been told by persons who are actually in the hospital with COVID that their nurse or a nurse's aide wouldn't go to their rooms unless they called, and that even when they call, it would take a while for someone to actually come to their assistance. It's just really sad. These people sign up to be caretakers, but when push comes to shove, they just show up and clock in to be share takers. They're just there for the money. Where's the compassion? Now let's get this straight. We all know it's not everybody. We know there are great healthcare workers out there. Salute to you guys. However, as we all know as well, one bad apple spoils the bunch. Well, the family made the decision to sue for neglect, elder abuse, and wrongful death. And I don't blame them. As per the document provided in the clip, the 3 children demanded that the maggots be cleaned and the steri-strips be replaced. Now, for those of you who don't know, steri-strips are adhesive bandages that are used to help seal a wound by pulling the 2 sides together, like this photo here. The document continues with when the nurse actually removed the steri-strips, stating, Copious maggots, meaning in abundance, or for lamest terms, a whole lot, crawled out of her face. My. That led me to ask, did she actually have an open wound? The document also included the nurse's note, and it reads, the patient's son and daughter were visiting today just before noon. At bedside, they inquired about the nose taping of the NGT, which was taped with the steri-strips, which had become soiled. I stated that I noticed it earlier but had not yet had time to retape the NGT, but since they were standing there, I said I would do it now. When I removed the existing soiled steri-strips, approximately 2 or possibly 3 dozen maggots started coming out of the patient's right nares, where the NGT was located. I removed the NGT and cleaned the patient's nose with alcohol wipes and iodine swabs. Another dozen or so maggots were removed. RT at bedside suctioned the patient's nose. The family was very upset and was requesting a transfer. Management, aware of the situation, the doctor advised. There was actually no claim of an open wound. Their mother had a feeding tube placed through her nares or nose, and it was being held in place by the steri-strips like so, or similarly. The nurse's note stated that the strips were soiled, and I guess that's what the maggots were following. But that leads me to wonder again, how did they become soiled? And for how long were they soiled? As I actually sit here and think, I assume the feeding that she was receiving was milk-based, so it spoils or rots. The more and more I think about it, it becomes more evident the level of neglect this woman endured. For the steri-strips to be soiled, clearly there was some form of error while they were giving her the feed. No one cared to correct the error before things got bad. They just let the spilled milk stay in place and rot in her nose? That's beyond ridiculous. The nurse's note also states 2 to 3 dozen maggots crawled out of after they removed the strips, and then another dozen or so was removed. Yuck. And then they suctioned. I wonder if that was to get out even more maggots that was up in there, or if she had some sort of fluid collected in there. Man, this is disgusting and heart-wrenching at the same time. Can you imagine as a family member standing there, looking on as they're removing all these insects from your loved one's face? Whew. No one should have to go through this. You know, I hope the family gets some sort of justice out of this lawsuit because, nothing can bring back their mom. And I also hope that they're able to find some level of peace in the justice they receive. Y'all, comment down below and let me know what you think about the situation. Is this what healthcare in the United States has really gone to? Oh boy.